Governor, thanks for taking a few minutes to sit down with us at a safe distance, of course. So I want to start out asking you about where we go from here. You've talked a lot this week about your hopes of lifting the stay-at-home order after May 9th. If things stay on track and you're able to do that, what does life in Rhode Island look like differently May 9th?
No, good question. I'm not sure it'll look very different the very next day, but I'd like to start to see more people out and about. I'd like to be able to lift the stay-at-home order. I'd like to start to see some people going back to work, re-emerging a bit. So, I think it's not, as I've said from the beginning, it's not going to be a flip of the switch. We're not all going to go to church that next Sunday. There's not going to be big crowds allowed, but, parks will be open again in some way, beaches will be open again in some way, businesses will start to be open again. I'm still going to encourage everybody who can work from home to work from home. We're still going to have to, keep our eye on nursing homes. There still won't be visitation to nursing homes, but you'll see some more activity. You could see shops opening again. You're going to be able to go out to, do some amount of shopping. Like it's going to start to be better. Today I announced that I want the hospitals to start getting back into the business of routine procedures, elective surgeries, elective procedures. So you'll start to see that kind of activity.
At different points in this crisis, I'd say you had different worries you talked about top of mind. Early on, it was testing, and when will there be enough testing? The nursing homes today were a big focus.
Yeah.
What is your biggest worry as you look forward as this crisis evolves right now?
It's a long list, but I'll try to, keep it short. I just want to make sure we're ready. So we're in a good spot right now. We're in a terrible spot economically. That is just crushing as a nation, not just in Rhode Island. But in terms of flattening the curve, we haven't overwhelmed our healthcare system. It hasn't been as bad as it would have been if we didn't do what we did. I just have to make sure we are fully ready, that we have the 30 days of PPE we need, that our contact tracing is up to snuff, that frankly, I'm really worried about the vulnerable populations. I worry so much about that. We're seeing this problem in the Latino community, seeing problems in urban areas. You're seeing outbreaks at meatpacking and protein processing facilities. The nursing homes, we still don't really have our arms around it. If you look at other countries that have gotten out of trouble and then got back into trouble, it's always been a blind spot.
Singapore.
Singapore. In Singapore, it was migrant workers living in dormitory type settings. They weren't testing them and they weren't educating them. Hong Kong, they let the college students come back too quickly. So I want to know what's my blind spot. I want to make sure we're covered so we don't have that, because I never want to have to close the economy again.
I hear from a lot of viewers who are glad that safety was prioritized first, but I do hear from business owners and workers who they say, the hospitals are only at 60% capacity.
Yeah.
We're holding at about 270 hospitalizations. There are a lot of cases, but the deaths are primarily, sadly, in the nursing homes. She overreacted. We didn't need to have this much economic damage.
Yeah.
What do you say to those folks?
Yeah. It's a catch-22, because the reason we're in pretty good shape is because we did the stay-at-home order and clamped down on our economy. If we hadn't done that, you would have seen the horrible experience you saw in Italy, running out of it was hot. You have to remember, they were running out of spaces for bodies, running out of ventilators, running out of hospitals. So the good news is we never got there. The bad news is we took the precautions in time to prevent that. So this whole situation we are in, there's no good answers. Every day, I work every day to make it a little less bad. There's no good options. There's no option A is bad, option B is worse, pick the least bad option. So listen, time will tell, but I would say I wasn't alone. I followed the direction of scientists. I followed the CDC. Most states did exactly what we did. And a few weeks ago, it was looking scary. I saw the models, 6,000 hospital beds, thousands of ventilators. We couldn't have handled that. The death numbers were horrible. So now we did the right things and we're in better shape. It's easy to second guess, and I sympathize with that, especially if they're out of work, but we did the right thing. I think we did the right thing.
I want to ask you quickly, I know this is still a little ways away in COVID time, but when you think about figuring out the state budget situation, at some point you all have to put together a balanced budget. Could you foresee yourself putting in a very revised, usually you do little amendments, but putting in just, okay, we can't do the one I put in January, here's a new one for this scenario? Have you thought that through yet?
Yeah, so it's going to be more than a little revised, let's be clear about that. It's going to be very rough. It'll be very difficult. I haven't put too much time into it yet because we still don't know how much money we're going to get from the federal government, and that is a huge variable. I mean, to put it in perspective, we have, call it $4 billion of state revenue in a given year, plus or minus. Well, we've already received $1.25 billion from the federal government. Now that can't be used to backfill revenue, but we know we're getting a lot more. So it's hard to even think about balancing the budget without knowing how much we're going to be getting from the federal government. What I do know is it's going to be tough, and the legislature and I are going to have to work it out together.
I want to ask you, people occasionally will email me asking a personal question like, wow, she's working a lot. Is she getting burnt out? What do you think? Or something. I'm curious. I looked, you've done a briefing every day but Easter when you taped one since like March 11th.
Yeah.
What was the lowest moment for you of this crisis?
Lowest moment. When in the early weeks, when I was looking at these models showing devastating numbers around deaths, hospitalization, hospital beds needed, ventilators needed, and we had no idea where we were going to get them. I mean, I was up all night calling everyone I could to get us the supplies we needed. The federal government was behind, the system was in chaos, and I didn't know how we were going to be able to do it. I had confidence that we'd figure it out, but those were pretty dark days because I had the responsibility to protect people, and I wasn't exactly sure how we could get it done. But we're past that now. There's still so much to do. Think about what I'm trying to do. Shut down an economy, reopen an economy. This has never been done before. What we're living through is, no one's ever done this. There's no playbook. Who do you call for advice? No one has said, oh, let me tell you about the last time I did that. So
it's not like a snowstorm where you can call your predecessor.
Exactly, a snowstorm, a hurricane, a more muted economic recession. Like, this is unique. So I rely a lot on the governors. We governors have all gotten very close. We call each other all the time and help each other out. But anyway, so now it's work and it's risk, and now I'm constantly focused on people's economic concerns, but those days were dark days. Those were dark days when you looked at what was going to be required and it wasn't at all clear that we were going to be able to do it. And you'd call FEMA and they'd say, I'm sorry, ma'am, we can't help you. We don't have anything. We're not prepared either.
One last question, and my fellow reporters would kill me if I didn't ask this directly. If you're able to lift the stay-at-home order, can reporters come back in the room to ask questions ourselves at the briefing?
I don't know. I will think about it and get you an answer. Probably soon, I would think, because we would but okay, let me say this. We still
I have it on camera now.
No. Well, we have to still stay 6 feet apart. We'll all have to you guys all have to wear your masks. It can't be very many people because there's still going to be restrictions. I don't know if it's 5 or fewer, 10 or fewer, but we'll figure something out.
All right, we'll
find a bigger venue and have fewer people. Maybe we'll rotate.
We'll
work on something.
We'll negotiate it with your press secretary.
Exactly.
But I appreciate the openness in that. Governor, thanks for the time.
Okay, thanks.